Welcome back, friends. In today's session we are going to continue our topic of anatomy, and today we are going to discuss about the anatomy of the upper limb. And for the case of today we are going to start about the muscles of the upper limb. So let's start our session. In general, the muscles of the upper limb can be categorized into two. You have the muscles attaching the upper limb to the exoskeleton, and these the muscles which are attaching the upper limb to either the thoracic wall and the vertebral column. So it is either the muscle they are attaching the upper limb to the vertebral column or the upper limb to the thoracic wall. While we have the muscles of the upper limb proper, which are the muscles of the shoulder region, muscles of the arm, muscles of the forearm, and the muscles of the hand. In this discussion, we'll focus more on the muscles of the upper limb proper. Muscles of the upper limb proper. So we'll not discuss much about the upper limb, which are muscles which attach the upper limb to the exoskeleton. We discuss some of them, few of them, but some of them we will discuss later in another session, discussing with the muscles of the back, because they are the one which are responsible, especially in attaching the upper limb to the exoskeleton. Now, muscles attaching the upper limb to the exoskeleton. We have the front muscles. And in the front muscles we have the pectoralis major. We have the pectoralis minor and subclavius muscle. Pectoralis major, pectoralis minor, and subclavius muscle. Those are the front muscles. And then you have the side muscles. In terms of side muscles, you have the serratus anterior muscle. And then you have the back muscles. In a group of back muscles, you have the latissimus dorsi, trapezius, levator scapulae, rhomboidus major, and the rhomboidus minor. Rhomboidus minor and major. So sometimes these are named as the rhomboid, not the rhomboidus. So don't worry if you see the name rhomboid in instead of rhomboidus. Don't get confused with these names. So only pectoralis major and latissimus dorsi muscle are inserted in the humerus. This is very important kwa sababu gani? Tuvo discuss session iliyopita kuhusu osteology, tukawa discuss muscle attachment kwenye bones. So pectoralis major and latissimus dorsi, they are inserted in the humerus, while all other muscles, they are inserted in the shoulder girdle, that is the scapula and the clavicle. So it is very important for you to understand these concepts when we are discussing about the anatomy of the upper limb. Now in this session we will not deal much with the muscles of the back, such as latissimus dorsi, trapezius, some like levator scapulae. We can discuss them, but not in much detail. We'll discuss them in another session. So let's go with the other muscles which we discuss more. So for the muscles which attach the upper limb to thorax, we have the pectoralis major, and as you can see the pectoralis major here, here we have the innervation of the muscle. So what you can see here ni kwamba kama unavyoona hapo, kwenye hizo nani, huyo hapa anakuwa ndo muscle yetu. This is our muscle. I mean this is our muscle, and from there this is our nerve which innervate the muscle. So for example, pectoralis major inakuwa innervated na medial pectoral nerve pamoja na lateral pectoral nerve, wakati tukienda kwenye pectoralis minor inakuwa innervated na nani? Medial pectoral nerve. So hapo nerve, hilo jina la nerve unamalizia mwenyewe. Subclavius muscle anakuwa innervated na nani? Nerve to subclavius from the upper trunk. alafu serratus anterior anakuwa innervated na long thoracic nerve. It is very important to know about this because sometimes you are asked about this innervation of the muscles. So if you don't know, it will be very difficult for you to understand. It will be very difficult for you to understand different innervation of the muscles. Kwa tuna pectoralis major, pectoralis minor, subclavius, serratus anterior, upper limb 2, thorax. The very important one to understand is the serratus anterior, which is innervated by a long thoracic nerve. Very common in MCQ as compared with the other ones in this description. So serratus anterior is very important as compared with the others. From there unaweza kuona mwenyewe hapo jinsi gani ambavyo vitu vinaonekana. This is the subclavius. Subclavius iko below the clavicle. Then you see we have the thoracoacromial artery. Thoracoacromial artery, not so much important to understand about the blood supply in this discussion. We will discuss it later. Then pectoralis minor, pectoralis minor tenda kuona vizuri, lakini this diagram does not explain well. Unaweza kuona tu hii ni artery, does not explain well actually. So here we have the sternal end of the pectoralis major muscle. So as you can see here, we have the clavicular head of the pectoralis minor. So this is the pectoralis minor, and this the pectoralis, all of this muscle is the pectoralis major. If we remove it, we cut it, we remove, then you get pectoralis minor inside. Kwa utakavyoenda cadaver ni very important hiyo, kata hii muscle usikate kama unachinja kuku, unakata kama unachinja cadaver, ili kwamba at the end of the day inside uweze kuona the pectoralis minor muscle. We have the deltoid muscle, then you have the cephalic nerve, clavicular triangle. Not so much important. There are no many detail in this diagram. And again, as you can see, this diagram they just show muscles. So as you can see, subclavius muscle ni hapo. Tunataka kuona pectoralis major, pectoralis minor, subclavius pamoja na serratus anterior. So subclavius ni huyo hapo, subclavius anakuwa innervated na nani? Nerve to subclavius. Then pectoralis major ni huyo hapo, pectoralis major. Pectoralis minor yuko ndani yake, ukimkata ukimwondoa. Teres ndio hizi zinazoonekana huko nyuma, hizi huyo hapa ni pectoralis major. Hiyo muscle ya kifua hapo, pectoralis major. Kwa kama mtu ukimkuta sio anapiga push up na kifua, it's just because of pectoralis major. Then serratus anterior. Serratus anterior ndio hiyo hapo, sio teres, ni serratus anterior. And as you can see the long thoracic nerve, hata kwenye diagram wameonyesha, na maana nikwambia it is very important for you to remember the long thoracic nerve innervating the serratus anterior. So here they are intercostal muscles and the intercostal branches of nerves, but the long thoracic nerve, it is very important for you to understand in innervation of the serratus anterior muscle. And then the muscles which attach the upper limb to the vertebral column, muscles attaching the upper limb to the vertebral column. We have the trapezius. We have the trapezius muscle, and it is innervated by the accessory nerve. Accessory nerve, very important. Trapezius accessory nerve, very important. And this accessory nerve also it is innervated by C2 plus C4, but actually the major nerve which innervates the muscle, it is accessory nerve. Then you have the latissimus dorsi. Latissimus dorsi, which is innervated by the thoracodorsal nerve. Thoracodorsal nerve. This is very important, hata kama usipoona importance yake sasa, lakini when we will be discussing about cadavers, it is very important for you to understand. Then from there we have the levator scapulae. We have the levator scapulae muscle, which is innervated by the C4, C3 and C4, and also by the dorsal scapular nerve. So levator scapulae, the important nerve which innervated it is the dorsal scapular nerve. Then you have the lomboid minor, which is innervated by the dorsal scapula. and rhomboid major, which is innervated by the dorsal scapula. So as you can see, the three muscles from levator scapulae, rhomboid minor, rhomboid major, they are all innervated by the dorsal scapular nerve. So unaweza kaona hapo, hii ni muhimu kwa sababu lazima ujue tukivunja dorsal scapular nerve, muscle gani zitakuwa affected. Na ukumbuke kule kwenye osteology tulisemaje, tukivunja sasa hii sio dorsal scapular actually, kwa sababu ile ilikuwa ni levator scapulae. Hapa tutapata ni drop the hand, tutapata ni drop the arm tukivunja nerve inayo innervate levator scapulae au trapezius. Sababu levator scapulae pamoja na trapezius zinafanya kazi ya ku elevate the scapula, kuhakikisha scapula inakaa kwenye sehemu yake. If you are doing the movement which involves the scapula, if you are doing this kind of movement, levator scapulae, it is very important. Kama unafanya movement kama hii hapa, unavo elevate the scapula, the position of the latissimus dorsi hapa inafanya scapula yako iweze ku elevate. So this movement, it is done by the levator scapulae. Ukiwa hauna innervation ya levator scapulae, you can't do such kind of movement. So it is very important for you to know kwamba ukiinjure a certain kind of nerve, what will happen to you, and that is actually because of the understanding the concepts of anatomy. So this is all about the nerves. The important aspects for you to remember is the accessory nerve supplying the trapezius, thoracodorsal, latissimus, and levator scapulae. Levator scapulae is supplied by dorsal scapula. So these are the important things to remember when you are discussing about the muscles attaching the upper limb to the vertebral column. And then from there, again, this diagram we have already discussed it. So here, as you can see, is just the diagram which shows different muscles, and they have their labels here. So for example, occipitalis, we don't deal with this now. We are dealing with the trapezius muscle. Then the trapezius runs downward. As you can see, it is inserted in the vertebral column. Then you have the latissimus dorsi. This one. Then from there, from the latissimus dorsi, we have other muscles inside. Teres major, we have teres minor, which is there. We have the infraspinatus. But here we are dealing with the rhomboid major and the rhomboid minor. We are dealing with the rhomboid major and rhomboid minor. We are dealing with the trapezius, and we are dealing with this muscle, latissimus dorsi. So these are the muscles which we discussed them more in this session. But what I mean here is that we will discuss other muscles of the upper limb. This is just like a kind of introduction for you to understand basics of the muscles of the upper limb. So as you can see, we have removed some of the muscles. For example, in this we have the superficial and deep group. In the superficial group, we have trapezius, infraspinatus, and in the deep group we have the levator scapulae. You see levator position of the levator scapulae, and the kind of movement which can be controlled by this muscle, which is levator scapulae. Also, you see the rhomboideus major and the rhomboideus minor. Other muscles will be discussed later. So, muscles of the shoulder region. So now we are going to start discussing the muscles of the upper limb itself, and we are starting with the muscles of the shoulder region. So as I told you in the osteology, the upper limb is divided into different sections. or into different parts. And then we have the shoulder region, we have the arm, we have the forearm, and then from the forearm last we have the hand itself. So from there, the shoulder region has 6. There are 6, all connected to the scapula, to the humerus. All connected the scapula to the humerus. We have 6 muscles. We have the first 2, deltoid and teres major, and then you have the last 4, teres minor, supraspinatus, infraspinatus, subscapularis. Deltoid and teres major. Then you have the last 4, teres minor, supraspinatus, infraspinatus, and subscapularis. Now these 4 last muscles, which are teres minor, supraspinatus, infraspinatus, and subscapularis muscle, all together they are named as the rotator cuff muscles. So they have this name from their action, which are they are joined together in the rotator cuff tendon, and when they join together in the rotator cuff tendon, they perform a function to stabilize the position of the shoulder, anatomical position of the shoulder, to avoid the dislocation of the shoulder joint. So what we are saying about the rotator cuff muscles, and this is the very common question in the MCQ, the rotator cuff muscles: supraspinatus, infraspinatus, subscapularis, and teres minor. So all of these spine, I mean it is scapula, but teres minor is the only one which doesn't have a kind of scapula, but all of these are muscles, scapula, they are related with the anatomical position, they are related with the scapula. So all arise from dorsal surface of the scapula except subscapularis. All arise from the dorsal surface except subscapularis, which arise from the anterior surface. So the common feature of these muscles is that all of them, they arise from the dorsal surface except the subscapularis. All form a common flat tendon, which is called the rotator cuff tendon. So they form a common flat tendon, which is rotator cuff, that attaches the proximal humerus, and will keep the humeral head centered in relation to glenoid cavity during shoulder motion. So as we know, the shoulder joint is one among the example of the ball and socket joint, and it can perform different kinds of movement. It can perform even the circumduction motion. So due to different motions performed by the shoulder joints, we need to have muscles which will tend to stabilize its position during the circumduction or different kinds of movement of the shoulder joint. These muscles will be maintaining the position of the head of humerus on the glenoid cavity, so that you will not dislocate. But these are the very important concept for you to know about the shoulder joint and the different kinds of movement which can be performed by the shoulder joint. And these kinds of movement, kama ambavyo shoulder joint inaweza kufanya circumduction, na inapofanya circumduction, that means it is very important, it is very easier for you to dislocate the head of humerus from the glenoid cavity. Kwa sababu gani? Glenoid cavity does not cover the whole head of humerus, na ndio maana it can undergo circumduction. And that is the nature of the ball and socket joint. All of the ball and socket joints, they are not covered with their cavity ya upande wa pili of articulation. So what we are saying that they rotate the arm medially or laterally, adduct the arm. All are supplied by C5 and C6 nerve. C5 and C6 nerve kutoka kwenye branches za brachial plexus of the upper limb, kama ambavyo tenda kuona kwenye nerve supply of the brachial plexus. Kwa unaweza kaulizwa labda kwenye MCQ unaweza kuuliza what are the common properties of the rotator cuff muscles, but actually they do not prefer the common properties. Actually they normally just mention these muscles and then they ask you about the rotator cuff muscles. But don't claim what teacher they will give you. So you are required to know all of these aspects, and then later unaweza wewe mwenyewe ndo ukawa unapata knowledge zaidi huko kwenye maswali. So from there, as you can see, we have deltoid, supraspinatus, infraspinatus, teres major, teres minor, subscapularis. So you see this teres minor is axillary nerve, infraspinatus is subscapular, in is suprascapular, suprascapular nerve, teres major ni lower subscapular, deltoid ni axillary nerve, lakini kwenye subscapular tuna lower subscapular na upper subscapular. Lakini all of this, what you need to know, the important aspect here is just the concept of rotator cuff muscles. Concept of rotator cuff muscles. Hizi nyingine innovation, sio vitu ambavyo utaulizwa sana in your gross anatomy kwamba what muscle ina supply deltoid muscle, what nerve ina supply deltoid muscle. However, it is very important to know some of the very important nerves such as the axillary nerve ambayo ina supply deltoid. If it is injured, means deltoid muscle, also the teres minor muscle will be paralyzed. So hizi ndo muscles unaweza kuona kwamba hii ndo scapula. Go from the scapula hapa chini tunakuwa na muscle ambayo ni nani? Huyu muscle hapa chini ni subscapularis, tuna infraspinatus na tuna supraspinatus pale juu. So these are the component muscles of the rotator cuff. You see, teres minor, then infraspinatus. So infraspinatus, supraspinatus, ini subscapularis. Subscapularis wanatengeneza nani? Rotator cuff. Infraspinatus, supraspinatus, subscapularis, wanatengeneza rotator cuff muscle. From there, these are the muscles of the front. Hii tushai discuss kwa nyuma. Lakini from there tuenda kwenye muscles of the arm. Tumeshaona muscles of the shoulder. Shoulder ina how many muscles? Shoulder tumesema na how many muscles? Ni 6. Tuna deltoid, tuna teres major. Deltoid na teres major. Kama ambavyo unaweza kuona hapa. Deltoid na teres major ndio sio component za nani? Za rotator cuff. Deltoid na teres major sio component za rotator cuff. Lakini tukianza teres minor, infraspinatus, supraspinatus na nyingine ambayo ni subscapularis, zenyewe ni component of nini? Rotator cuff. So tuende kwenye muscles of the arm. Arm ni rahisi tu, ina only 4 muscles. Only 4 muscles. Arm ina only 4 muscles. We have the biceps brachii, triceps brachii, then you have the coracobrachialis and brachialis muscle. So only 4 muscles. In the anterior compartment of the arm, tuna biceps brachii, coracobrachialis and brachialis muscle. The biceps brachii, coracobrachialis and brachialis muscle, they perform a function of flexing the arm. Wakati huo in the posterior compartment, triceps brachii inafanya kazi ya kufanyaje? Ku extend the arm. So cross elbow move forearm, 2 compartments, each having its muscle, nerves and arteries. We have the anterior compartment ambao kuna flexors of the arm, ambao kwenye anterior compartment tuna 3 muscles. All of these muscles of anterior compartment, they are innervated by the musculocutaneous nerve, which is the terminal branch of the brachial plexus, kama ambavyo tutaenda kudiscuss baadaye. So musculocutaneous nerve is the terminal branch of the brachial plexus. Brachial plexus yenyewe ndo inafanya innervation of the upper limb. Lakini tuna radial nerve ambayo ina innervate nani? Triceps brachii. Triceps brachii kama tulivyosema kule mwanzoni kwenye myology kwamba triceps, that means it has 3 heads. It has 3 heads. While biceps, it has 2 heads. So all the 3 heads of the triceps brachii, they are innervated by the radial nerve. So Yeah, as you can see here, we have the biceps brachii. Then from there we have the brachialis muscle, and then from there we have the triceps brachii with the 3 heads. We have the lateral head, you have the long head, you have the medial head, lateral, medial, then long head of the triceps brachii. It has 3 heads. Then you have the radial nerve there innervating the triceps brachii. We have the ulnar nerve, then median nerve, median cutaneous nerve. All of these, they do not innervate the arm, they innervate the forearm. But the musculocutaneous nerve is the one which innervates the biceps brachii, then coracobrachialis and the brachialis muscle, and they are not shown in this diagram. So this is the cross section of the upper arm just below the level of insertion of the deltoid muscle. Below the level of insertion of the deltoid muscle, this is the humerus. So as you can see, this is the short head of the biceps brachii, Then we have the long head of biceps brachii. As you can see, the short head of biceps brachii imeoriginate kutoka hapo kwenye hiyo olecranon. It's not olecranon actually. It is it is coracoid. It is coracoid. So sometimes even if you are teaching, but it is sometimes very difficult to remember if you don't have experience of just reviewing this concept many days. And as you know, we have many things to do. So this is the coracoid process, and the coracobrachialis and the long head of the biceps brachii, short head of the biceps brachii, they originate from the coracoid process. From there we have the long head. This is the short head. Long head of biceps brachii imepita pale kwenye ile fossa au kwenye ile groove iliyoko kati ya tubercle, kati ya greater tubercle na lesser tubercle. Kuna groove hapo, ambayo hiyo groove imeallow hiyo tendon kuweza kupita hapo kama unavyoweza kuona. Lakini hapo kuna transverse humeral ligament inaishikilia ile pale, transverse humeral ligament inaishikilia ile pale ili stoke kwenye ile position. So that the anatomy of these muscles. Is other muscles so somehow important for you to know, kwa sababu tushazi discuss kule nyuma. Lakini this is the infraspinous. This is not the infraspinous, it is subscapularis muscle. Sub means below, so subscapularis, it is below the scapula. Hii hapa kwa mfano ni latissimus dorsi. Latissimus dorsi muscle ambayo tutaenda kuiona huko mbele. Lakini hiyo kwa ndo posterior view ya mkono, unaona lateral head of triceps brachii, Hapa pamekatwa ili tuone kwa kuna radial groove of humerus ambapo inapita radial nerve. So radial groove of humerus inakwenda pita hapo radial nerve. And then from there kuna other muscles ambazo zina originate hapo zinaenda kwenye forearm. Lakini pia kuna unaona olecranon process hapo. And then we have the long head of triceps brachii, long head, yeah. Lakini in short, triceps brachii yuko nyuma, anafanya movement gani? Extension. Biceps brachii yuko mbele, anafanya movement gani? Anafanya flexion. So when you are doing the flexion and the extension of the forearm, the joints and the joint which is moving and the muscles which are responsible ndio kama ambavyo tumezizungumza hapo. From there, let's move to the muscles of the forearm. Sasa forearm hapa, we have many muscles. Actually, we have many muscles in the forearm, and sometimes it can be difficult for you to remember all of them, but just grasp some of the concept and understand them. They can help you to answer your exams. However, even myself, I actually don't know all of them, so I can't say you that I can't tell you that cram anything or just study anything. Make sure you understand all. Even myself, I don't understand all, and you can pass exam even if you don't understand all, because in this course we are just training you to be the medical doctors. So these basics of anatomy will help you in different aspects, but it's not the matter for you to be maybe a senior lecturer in anatomy. So close elbow, wrist and finger joints. These muscles, they cross the elbow joint, the wrist joint and the finger joints. Now, in the case of these muscles, they control the movement of hand and fingers. They cross wrist, and because they cross wrist, they perform a function of flex, then extend, abduct and adduct the hand. Flex, extend, abduct and adduct the hand. But they cross fingers, so they flex and they extend the fingers. These muscles, the forearm. So proximally they are fresh. Proximally they are fresh, but distally have long tendons. Kwa unaweza kukuta kuanzia kwenye wrist mpaka kumwishoni zina tendon. For example, there are 3 fascial compartments, each having its muscle, then each having its nerve and blood supply. Because zina 3 fascial compartment. Forearm in a 3 fascial compartment. It's not, for example, it's a forearm, 3 fascial compartment. Kwa tuna anterior, posterior, lateral. For every compartment you should understand the muscle of the compartment, nerves of the compartment, and the blood supply of the compartment. So we have the flexor and we have the extensor retinacular. Flexor and extensor retinacular. We have the flexor and extensor retinacular. So wrist bands which keep the tendons from jumping outward when tensed. Kwa hiyo hizo flexor and the extensor retinacular zenyewe zinafanya kazi ya kuhakikisha kwamba tendon haziondoki. Unaweza kuona hapo kuna anterior compartment, lateral compartment na posterior compartment. Na for every compartment tulikwambia uelewe nerve supply, blood supply pamoja na muscles. So for anterior compartment you have different muscles. As you can see, we have lateral compartment na posterior compartment. Tukianza na anterior compartment of the forearm. Anterior compartment of the forearm, we have the superficial group. Superficial group have a common tendon of origin at humeral medial epicondyle. Humeral medial epicondyle. Humeral medial epicondyle is the origin of these muscles. We have pronator teres. Pronator teres. We have the flexor carpi radialis. Flexor carpi radialis. That means it flexes the carpal bones, but it lies parallel with the radius. Then we have the palmaris longus. Palmaris longus. Ko hiyo inafanya movement ya palm, yani kiganja, but longus, that means it is long. Then we have the flexor carpi ulnaris. Uzuri wa hizi muscles baadhi majina yake yanafanana, yani flexor carpi radialis, flexor carpi ulnaris. Maana yake na flex carpal bones lakini iko kwenye upande wa ulnar, ina flex carpal bones iko kwenye upande wa radius. Then unakuta kuna pronator teres pamoja na palmaris longus. Hizo ni superficial group. Toka hapo kuna intermediate group. Kuna flexor digitorum superficialis. Manake ina flexi digits. Digitorum, it is digits. Superficialis, that means it is superficial. So it is flexor digitorum superficialis. Lakini kwenye deep group lazima ujue kwamba kama tuna superficialis lazima tutakuwa tuna profundus. Kama kwenye intermediate group tuna superficialis lazima iko na nani? Na profundus. So tuna deep group ambapo tuna flexor pollicis longus, Ukumbuke kule juu tulisema kuna hatukudiscuss kuhusu flexor pollicis, lakini flexor pollicis tunapozungumzia flexor pollicis, that means inakwenda flex kiganja. Pollicis I mean kidole gumba, pollicis ni kidole gumba. So we have the flexor pollicis longus, flexor pollicis longus. Na kila muscle utakayoona flexor, ukumbuke kwamba kama this is the anterior compartment, ukienda kwenye compartment nyingine ambayo ni posterior, utakuta kuna nini? Kuna extensor. Kama sio kwenye posterior, basi kwenye lateral utakuta kuna extensor. So hizi flexor zote hizi, kwa sababu muscles ni nyingi, hizi flexor zote hizi, unajua flexor iko kwenye anterior, basi unajua automatically lazima kutakuwa kuna extensor kwenye posterior. So we have the flexor pollicis longus, so that means we have extensor pollicis longus in the posterior group. Then you have the flexor digitorum profundus. Also we have pronator quadratus. So these are the muscles in the deep group of the anterior compartment of the forearm. Flexor pollicis longus, and then flexor digitorum profundus and pronator quadratus. So yeah, these are the muscles of the anterior compartment. So as you can see, the superficial group of muscles you can see here, the palmaris longus muscle, it flexes the palmar. Then we have the palmaris longus, its tendon is attached to all of these phalanges. Then you have the flexor carpi radialis longus, flexor carpi radialis longus, then flexor carpi ulnaris, flexor carpi ulnaris. Then we have the pronator teres muscle. Pronator teres muscle is just the short muscle ambayo imeanzia pale kwenye hiyo ni kwenye lateral. I think this is the lateral or medial epicondyle. It's medial, not lateral. Pronator teres yenyewe imeanzia pale kwenye medial epicondyle, imeenda hadi kwenye ulna, I mean kwenye radius. So imeanza kwenye medial epicondyle, imeenda kwenye radius. Medial epicondyle imeenda kwenye radius ambayo ni lateral kupembeni. So actually ni kwamba hii muscle sio ndefu sana kama zilivyo hizi muscle nyingine, na ime cross only one joint. In cadaver, hii muscle it is very obvious seen in cadavers when you are dissecting. But as you can see in the deep group, we have the flexor digitorum superficialis. I mean in the intermediate group, flexor digitorum superficialis, you have this muscle in the intermediate group. But if you remove this flexor digitorum superficialis, in the deep group you get the flexor pollicis longus, pronator quadratus muscle. Pronator quadratus muscle, it is here, and it is shape with quadrant, ni pembe nne, shape yake ni pembe nne. And this muscle also in cadaver, it is very obvious, wengi nakutata jina yake hawajui, ni pronator quadratus muscle. Then you have the flexor digitorum profundus and anterior interosseous nerve. This is not the muscle, it is just the nerve supplying the interosseous membrane, anterior interosseous nerve. Now let's move to the posterior compartment of the forearm. In the posterior compartment of the forearm, again you have the superficial group. They have the common tendon of origin on the humeral lateral epicondyle. So the superior group, their origin is lateral epicondyle, and we have different muscles here. We have the extensor carpi radialis brevis, extensor carpi radialis brevis. If you remember, in the anterior compartment we had the flexor carpi radialis longus. So its function was to flex the carpal bones, and it lies parallel with the radius bone, and also it is the longest, that means it is long. So in the posterior compartment you have the extensor carpi radialis brevis. That means it extends the carpal bones and it lies parallel with the radius, but it is brevis. Brevis, that means it is short. We have the extensor digitorum, muscle. We have the extensor carpi ulnaris, extensor digiti minimi, and the ulnaris muscle. So we have about 6 muscles in this superficial group of the posterior compartment of the forearm. And as I told you that it is not somehow important for you to memorize the names of these muscles, because you will not ask all of these muscles in your MCQ. But what is important is to understand the concept and even the origin. Sometimes you may be asked maybe the origin, and if you are asked about the origin, as you have discussed, that all of these muscles, they have the origin in the lateral epicondyle of the humerus. So don't worry about the names of the muscles and how will you memorize all of these muscles, but what you need to know is just to pass through the MCQs and to know how the MCQs they are asked in this part of the forearm. From there we have the deep group of the muscles of the forearm, and in the deep group we have the supinator, we have the abductor pollicis longus, and as I told you, abductor, that means it performs the function of abducting the pollicis. Now pollicis, that means it is the thumb, kwa inafanya movement ya thumb. Longus, that means the muscle, it is long. So abductor pollicis longus. Sometimes if you don't know the muscle, but if you are going to dissect the cadavers, you need to know about the nomenclature of the muscles. That when we are talking of the pollicis and when we are talking of the longus, what do we mean? Because in the cadavers you will see the anatomy of the muscle itself, kwa utaona the gross anatomy of the muscle. Kwa kama unaelewa abductor pollicis longus, okay, this muscle must attach on the thumb, and this muscle must be long. So abductor pollicis longus might be this one. How it performs its function, it is to abduct. Can this muscle abduct the thumb? If it can abduct the thumb, probably it can be the abductor pollicis longus, even if you don't know the exact name of the muscle. But it can increase your chances of performance in your oral exams in cadavers when you're doing oral exams. So that is the abductor pollicis longus. Then we have the extensor pollicis brevis. So it extends the thumb. It extends the thumb, which is pollicis, but it is brevis. That means it is short. Extensor pollicis brevis. We had the flexor pollicis brevis in the anterior compartment. We had the flexor pollicis. No, we had the flexor pollicis longus. Here we have the extensor pollicis brevis. Then we have the extensor pollicis longus. You see, the extensors, they are of two kinds, brevis and longus. All of them, they tend to extend the thumb. And then we have the extensor indicis muscle, that is the deep group of the posterior compartment. So in the posterior compartment you don't have the intermediate group of muscle, but you have the superficial and deep. Then let's start let's finish our discussion the muscles of the forearm by discussing the muscles of lateral compartment. In the lateral compartment you have the brachioradialis, and then you have the extensor carpi radialis longus muscle. So only two muscles in the lateral compartment, brachioradialis and extensor carpi radialis longus muscle. So yeah, these are just diagrams which tend to show the anatomical position of these muscles in the forearm. I hope you learn more about these muscles when you be going to discuss about to dissect cadavers, and you will see these muscles. And actually it's not so much important for you to claim the name of each muscle in your exam. So here we have the superficial group. Here we have the superficial group, and here we have the deep group of these muscles. Again, this diagram they explain that the same. We have the supinator, posterior deepest layer, unakuta kuna muscles kama supinator and other muscles which perform the flexion function of the wrist and the thumb. So from there, this diagram summarizes all muscles of the forearm and the innervation. Don't get confused with this diagram, and it's not so much important for you to understand everything from this diagram, because actually unaweza kuona tu kwamba hata diagram yenyewe tu ukiona inakutishia kwamba you can fail anatomy, but it's not true. You can pass anatomy, but it's the matter of time. Unaweza kuitumia kusoma and solving just MCQs of anatomy. So kama ilivyokuwa kule mwanzoni, these are the nerves which innervate these muscles. Here on the left we have the nerves, then here we have the muscles, and they have divided the muscles in the compartments. Here is the anterior compartment, lateral compartment, and the posterior compartment. And unaweza kuona kwamba kwenye anterior compartment muscles zinakuwa supplied by the median nerve. Kasoro flexor carpi ulnaris anakuwa supplied by the ulnar nerve. Lakini angalia kuanzia pronator teres median, flexor carpi radialis median, palmaris longus median, flexor digitorum superficialis median, flexor carpi longus median. So many muscles in the anterior compartment of the forearm, they are supplied by the median nerve, and the median nerve is the lateral branch of the brachial plexus. So these muscles they are supplied by the median nerve, but in the lateral compartment muscles they are supplied by the radial nerve. The radial nerve also is the terminal branch of the brachial plexus, and as we shall discuss later in the next sessions, the brachial plexus is the nerve supply of the upper limb. From there we have the posterior compartment. In the posterior compartment you have the innervation by the radial nerve. So as you can see, extensor carpi radialis brevis, we have the deep branch of radial nerve, then extensor digitorum, deep branch of radial nerve, extensor digitorum minimi, deep branch of radial nerve, radio. All of these muscles, they are supplied by the radial nerve. For example, as you can see this in the posterior compartment. So sometimes you may be asked in the MCQ that the muscles of the posterior compartment of the upper limb, they are supplied by what nerve? Then they give you A. So if they give you option, maybe it's radial nerve, then another option it is the deep branch of radial nerve. The deep branch of radial nerve, it is the most correct answer, kwa sababu in MCQ already they give you answers which are similar, and sometimes the answers might be correct, but the most correct answer, the one which will be marked by your examiner. So apply the anatomy of the muscles of the upper limb. We have the tendinitis elbow. And here it is because of the lateral epicondylitis. That means the inflammation of the lateral epicondyle. So it is caused by the partial tearing or degeneration of the origin of superficial extensors from the lateral epicondyle of the humerus. Symptom, unaweza kuona kuna pain, kuna pain on the outside or lateral of the elbow, is usually gradual with the tenderness felt in the tenderness felt on or below the joints prominence. Kwa tenderness ni kama maumivu fulani hivi ambayo unaweza kupata. So seen in the tennis players na violinists pamoja na nani na housewives. Violinist maana yake ni wale watu wanao play violin string. Kwa hiyo watu wanaocheza tennis wanao play violin string pamoja na housewives. Yani watu nyumbani wanaweza kupata hii tennis elbow, that is the inflammation of the lateral epicondyle. Tunaweza kawa labda alivyoanguka kukuta kuna inflammation au bacteria infection wameweza kuinvade pale lateral epicondyle, at the end of the day unaweza kupata hiyo hapo, kwa sababu inapatikana kwenye tennis players, ndio maana wameita tennis elbow. Lakini from there we have the golfer's elbow. Difference kati ya tennis na golfer's ni kwamba hii inakuwa kwenye medial epicondyle. Tennis inakuwa kwenye lateral, golfer's ni kwenye medial. It is due to degeneration of the flexor muscle from the medial epicondyle. Kwenye symptoms tutapata pain, tutapata tenderness affecting on the inside medial, seen in golfers, also in persons doing similar movements. Kwa hizi hapo zilipewa majina kutokana tu na jinsi ambavyo zinaweza zikaapia kwa watu mbalimbali. From there also we have the bursitis, that means the inflammation of the bursa. So seen in the back of the elbow, it is often due to excessive leaning on the joint, or a direct blow or fall onto the tip of the elbow. Kwa mtu akianguka hapo, inflammation, bacteria wanaweza kaingia pale, wakapata chance wakaingia, na wakiingia wanapelekea hiyo bursitis. Akona una shida hapo kwenye hiyo olecranon fossa yako ya mkono. So we also have the compartment syndrome of the forearm. There is very little room within each compartment for the forearm. Kwa hiyo in the compartment syndrome, normally ni kwamba kuna fluid ambayo imeaccumulate kwenye each compartment. So we have the edema. Any edema can cause secondary vasculature of the blood vessel. Veins are first affected, then arteries. So edema maana yake ni accumulation of the fluid, accumulation of the extracellular fluid imeaccumulate, na ilivyo accumulate imesababisha blood vessels zishindwe kupitisha blood vizuri. And in this case the veins they affected first, then artery. Kwa sababu gani? Veins they pump blood kwenye low pressure, but arteries, because they pump blood at high pressure, it is very difficult for them to become affected. Also we have the carpal tunnel syndrome. In the carpal tunnel syndrome, first you need to understand about the concept of carpal tunnel. Carpal tunnel, we are saying that it produces by the flexor retinaculum over the carpal bones anteriorly. So structures passing into the carpal tunnel, tuna flexor digitorum superficialis and profundus, flexor pollicis longus and median nerve. Flexor carpi radialis has its own canal in the groove of trapezius. Kwa hiyo hizi structure hizi zote zinapita kwenye nini? Kwenye carpal tunnel. Carpal tunnel unaweza kaona hapa carpal tunnel jinsi ilivyo, na jinsi gani ambavyo hizi nerve, kwanza median nerve inapita hapo kwenye carpal tunnel. Hii median nerve inapita hapo, unaona kuna flexor carpi radialis tendon, yani all of these structures zinapita pale, manake ili kwamba zisidislocate. Unaona? Sasa sometimes this can undergo inflammation. In the clinical notes here we have the carpal tunnel syndrome. So in the carpal tunnel syndrome is the compression to the median nerve in the tunnel due to hypothyroidism, rheumatoid arthritis, pregnancy, amyloidosis, etc. It is a very painful condition. Kwa tuna compress nini? Median nerve. Yani kwamba sio kwamba you compress it by your own will, lakini it is because of the medical condition ambayo inatokana na either hypothyroidism au rheumatoid arthritis, pregnancy, amyloidosis, etc. And it's a very painful condition. So by compressing the median nerve which is passing through the carpal tunnel, unaweza kupata hiyo carpal tunnel syndrome. So in MCQ sometimes they can be asked you that patient alienda hospitali akawa examined sijui nini, maswali mengi, maelezo mengi, then last watakuuliza what are the components passing through the carpal tunnel? A, they can mention for you, and then you wana hata jibu moja tu ukose, au wanakuuliza kwamba what among the following components is not passing through the carpal tunnel? So it is very important for you to know what are the components passing through the carpal tunnel. So extensor retinaculum, Extensor retinaculum, it is found in this place but posteriorly. So cover the carpal bones distally and has septi which produce 6 tendon compartment through which tendon of the extensor muscle and the abductor pollicis longus pass. So yeah, and this is the end of the muscles of the forearm. Now let's discuss a little about the muscles of the hand. So in the hand we have many muscles, and many of these muscles they are short. So this diagram actually summarizes the muscles of the hand. I know some of you maybe you are using the Teach Me Anatomy application, and in the Teach Me Anatomy application somehow it is explained well about the muscles of the hand and even about the anatomy. So yeah, this is the diagram which summarizes the muscles of the hand. So we have the palmaris, brevis, we have the lumbricals which are 4, intersei which are 8, we have the short muscles of the thumb, we have the short muscles of the pink each kidole kidogo. Thumb ana short muscles pamoja na pink ana short muscles. Kwa mfano kuna abductor pollicis brevis, huku kuna abductor digiti minimi. Kwa ni kama tu majina yambadilika kidogo tu. Abductor pollicis brevis, that means it abduct pollicis, that is the thumb, then brevis it is short. Huku tunaita abductor digiti minimi. Flexor pollicis brevis kunaita flexor digiti minimi. Alafu then tuna opponens pollicis kunaita opponens digiti minimi. Kwa ndo hivyo. Kwa mfano huku kwenye pink inakuwa supplied by the deep branch of the ulnar nerve, wakati kwenye thumb it is supplied by the median nerve, except nani abductor pollicis naye anakuwa supplied by the deep branch of the ulnar nerve. From there we have the interossei and things like that. So this diagram just summarizes the muscles of the hand, and we have not shown them in diagram in this lecture, but I beg you to go through the atlas, NECTA's atlas, and you can see different muscles of the hand. Also you can use even the Snell's clinical anatomy book. You can use the Murray clinically oriented anatomy, and you can use, yeah, I don't recommend using the application like Teach Me Anatomy, because even myself when I was studying I didn't use that application so much. I recommend using books, because books they are different, but Teach Me Anatomy, it's not a reference book, and you can't get any reference book to compare with the Teach Me Anatomy. So thank you everybody. This marks the end of our session. In the next session we can discuss muscles of the back, and we can do a recap on the muscle of the upper limb before discussing the blood supply of the upper limb. So thank you everybody, and let me wish you nice studies.